Welcome and a very good evening. I'm Sushma Morthania, Director General India SME Forum, inviting you to the virtual conference on sanitation and hygiene for a new Swachh Bharat. We are organizing a series of virtual conferences as a part of our Health and Immunity Virtual Expo, which was inaugurated on 1st of October. Today, I am joined by a very power-packed list of eminent dignitaries to whom we shall interact and listen to their points. But before that, I would like to welcome all our friends, our members and entrepreneurs who have joined us live on Facebook and YouTube. I'm being told that we have about 1,091 viewers watching us as of now. And once again, a very good evening and welcome to all our viewers and all the esteemed speakers joined with me today. When we talk about sanitation, sanitation as an activity or why sanitation was so important, good water, good air, good surroundings, though we were all aware, it was only limited to keeping our homes clean. We never thought about keeping our surroundings clean, our state clean, our country clean. And it was first, actually, I would say, thrust upon us, or the entire idea was brought upon us by our Honorable Prime Minister, Shri Narendra Modi, when he launched this Swachhata Abhiyan. It's he who started talking about having toilets in each home, not to have open defecation, clean water, sanitizing rivers, Ganga rejuvenation, and so many more such initiatives. We all talk about sanitization and hygiene, and what are the opportunities it has thrown up, and especially post COVID. So we have started taking sanitization and cleanliness more seriously. So today we are going to talk about uh, what kind of opportunities, what kind of challenges, and how we can, adopt a hygienic lifestyle post-COVID as a part of our life. And what is it that developed nations have already done, and what is it that we need to achieve in our country is what we are going to discuss today. Before we start with, and I start introducing our esteemed panelists, I just would like to read out a few numbers about our expo. So far, we have 107 exhibitors exhibiting at this virtual expo. We have 2,195 visitors registered so far, 835 meetings scheduled, of which 339 meetings have been completed. So with that, once again, welcoming our esteemed speakers, I would like to first introduce Dr. Rene Van Berkel, UNIDO representative in India. He heads the regional office of UNIDO in India and coordinates country offices in Afghanistan and Bangladesh. He has 30 years of professional experience in resource efficiency and cleaner production, industrial productivity, and sustainability, with extensive international experience in Europe, Australia, and Asia, covering a variety of manufacturing and related sectors. Welcome to you, Dr. Berkel.
Thank you.
I would also like welcome. I would also like to introduce all our panelists briefly, and then we move on to our first question. We have with us Miss Tapsi Chakraborty, who's the CEO of a housekeeping company called Astute Care. And she is leading this company for 14 years, and it's one of the most trusted housekeeping service providers of India, and it ranks amongst the top 25 housekeeping companies. Welcome, Tapsi.
Thank you.
We
Namaskar.
We have Miss Amruta Padmaraju Tanda, founder of Aditi Enterprises. Her experience of working with an NGO with underprivileged women inspired her to start manufacturing organic and biodegradable sanitary pads, which were quite cost effective and affordable for these rural and underprivileged women. So, welcome, Amruta. We have with us Mr. Vasanta Rao, Managing Director of Vajjat Pharma Foods. It's a manufacturing company that makes food additives, processing aids, and non-dairy products along with chemical compounds. Joining us, we also have Mr. Adesh Soni, proprietor of GoCo India. After his successful stint with Merchant Navy, he started with GoCo for manufacturing protective kits for travelers, which is a new concept of care buddy kit for people who are in quarantine. Welcome, Mr. Soni. We have Mr. Saran Subramanian, CEO, Airtas Environics. He's an environmental entrepreneur and he focuses on air pollution control devices by improving socio-environmental well-being at industries. In his initiative, he has improved the air quality index of more than 60 industrial workplaces. He is currently working on an awareness initiative for automotive air pollution and an innovative project for urban air pollution control. Welcome, Mr. Subramaniam. Mr. Ashutosh Wadanagekar, Managing Director, Amalgam Biotech. Ashutosh is the founder of Amalgam Biotech. He has been in the field of manufacturing of prebiotics and probiotics and has 22 years of experience in field of water pollution control, sanitation, and manufacturing of bacteria for wastewater applications. His company is registered with Namami Gange for cleanup of River Gange, and their product, Bactacult, has received many national innovation awards from the Government of India. We have with us Mr. Amit Agarwal, Managing Director, DSI Robotics. Amit is also a pioneer of water, wastewater, and marine robotics in India. He is MD of DSI Robotics. It's a premier solutions provider for water and wastewater asset inspection, repairs, maintenance services for municipal, industrial, and marine sectors. Welcome, Amit. And lastly, we have Mr. Virender Kaul of Newmark Pharmaceuticals. He started this company in 2011 and ventured in the field of critical care equipment, mainly high-end ventilators for ICU. So his company deals with the service center of these high-end ventilators, which are being served at various high-level hospitals across India. He has recently also diversified into manufacturing of disinfectants and sanitizers. So that's esteemed and quite an exhaustive list of our panelists who have joined today. Welcome to one and all. I would like to start our discussion today with Dr. Burkell, because I'm aware that he has been personally doing a lot of work into sanitation, clean tech, and hygiene related initiatives. So we would like to hear from Dr. Barkel on his international perspective on these initiatives and on his work in India. Over to you, Dr. Barkel.
Sushma, and good evening to all. Thank you for inviting UNIDO. We are the United Nations Industrial Development Organization. I think the whole current COVID crisis or pandemic has put the spotlight on sanitation and hygiene. So it's clear that the transmission of infections is a hygiene issue, and infection prevention and control is a key approach for that. I think if we talk about sanitation and hygiene, there is kind of from the business perspective two dimensions to this, and maybe in this panel you already covered that. The one perspective is sanitation and hygiene is of course a business opportunity in a sense of provision of goods and services for the sanitation and hygiene sector, and that is also some work that we've been doing. But I see also some of the other panelists on the panel are representing that. I think the other part of which I feel at times is a little bit overlooked is the fact that we also have the issue as a business opportunity for all businesses to improve hygiene and sanitation in the workplace. And if we do that, so to provide proper toilets, drinking water, a decent place for lunch, for breaks, and so on, we are actually seeing that that the productivity and the retention of the workforce is improving. And this, I think, so there's a really return on investment if we invest in wash facilities in the workplace, and this is applicable to all enterprises. But we see the difficulty there that, and this is perhaps one of the biggest challenges, and maybe I'll finish there with the first comment, but I can come back later on. I think the biggest challenge is that we still see sanitation, hygiene as a cost. So it's a cost if we do urban development, it's a cost if we do business, it is a cost if we set up factories. And that is basically gets us on the wrong tangent. It is ultimately an investment in people. And if you take it, if you look at it at a perspective from an investment, one will always try to maximize return on investment. And we need to do that to see how can we make sanitation and hygiene work for the benefit of business, for the people. And in the current mindset, we see this a little bit like a cost factor. And a cost factor is something which we always want to cut corners. We want to reduce cost if we're in business. And that brings us to the situation that where we are, that the mindset is a little bit on saving costs on hygiene. I mean, I can give more examples, but maybe we can go later a little bit more on the healthcare, and I will give it back to you, Sushma, to take also some questions and introductions first from the other panelists. Thank you.
Sure. Thank you very much, Dr. Barkel, for giving that perspective that yes, I mean, hygiene and sanitation need not be looked at as a cost, but it is now become an investment, especially post-COVID. So I think the way we look at sanitation and hygiene, we all need to change our perspective about it. So I would like to, one by one, from all our panelists, I would like to know that what does sanitization and hygiene mean to them, and how are they implementing it presently in their enterprise or premise or in their daily operations. So we would go to Tapsi.
Yeah, hi. Today's scenario, after the post COVID-19, hygiene is the most important things all over the India, but as well as the world actually. So we did lots of, lots of, the sanitizations in our company. We did businesses, like started businesses sanitizations. We said that all of the employees, they have to be wear masks, as well as they have to be sanitize their hands, and they have to be use the sanitizer. So these all are the all these things we are implemented. And already Indian government and the MHA guideline also said that we have to maintain the distance minimum 6 feet, two gaj duriya, we have to maintain this distance. So we did these things in our organization, as well as we started new business like sanitizations, cleaning. We started this business. We started we have to every household, they have to clean their houses also. We have to generate the awareness as well. So we did all these things.
Thank you, Tapsi. May I request Mr. Virinder call from Newmark?
Namaskar.
Namaskar.
Yes, what are you speaking about?
Yes, I would like to know what, according to what kind of sanitation and hygiene measures you have taken at your premises, and what does it mean to you?
You see, I basically am dealing in a pharmaceutical manufacturing, and sanitization as such is a normal practice with us. We would clean our factory almost every day, but alternately with these sanitizers and whatnot, which are being used now. Because in pharmaceutical company, you have to be very much aware about these things and to be cautious. Unless and until you clean your factory, you cannot produce quality medicines. So for me, it was nothing new. We have been practicing this sanitization since the day number one, since we started manufacturing. So for me, it is not new. This has to be adapted. The problem is our masses. In India, people don't bother about sanitization. They feel sab chalta hai. Even if they eat, something falls from their hand and they will still pick it up and eat it. We have to make them aware, make them understand the need of sanitization, which is the real task. You go to market, the government has given some relaxations. People go in the market, they don't bother. You go and see 80% people are wearing masks in their chin only. Why? कुछ नहीं होता. This is the real challenge. We have to teach our masters that this is a
Yes.
must. You have to keep cleanliness at every stage. Every stage, I repeat. You go to villages now, just because of our honorable prime minister, there is some difference, 80-90%. Otherwise, in the morning, even you would travel by train, you would see everywhere people are defecating like anything, like animals. They don't bother. No shame, even in presence of each other defecating. So the real chance about this sanitization is to teach public. Public has to know the need of sanitization. I personally feel this COVID has done something good for public. Now, some people started thinking about the interiors also, that we must do something, we must do something. But what something, they are not very clear. They feel only putting a mask under their chin is sufficient, and that has to be taught to them.
Amrita?
Yeah, thank you for giving me thank you India SME Farm for giving me this opportunity to participate in this webinar. In this, uh, India needs more sanitization in this crisis. Not only after COVID, also before COVID, also our India was not much interested in taking precautions in sanitation. Why? Because as I was in a biodegradable sanitary napkins, I was taking so much of careful and sanitization tips, and taking more care of my employees also. But before COVID, all customers and all of my employees are not that much aware of hygienic. What does the importance of hygienic and cleaning before we are using the products like that? But after COVID, they are people get attention of using masks and using sanitizers and hands gloves. Nowadays, hand gloves are also making a very prominent place. Whenever I am using and manufacturing, whenever I was in my unit, I was very much, I was very much of taking care about our sanitary pads while packing and while taking UV sterilization also. That was giving more hygienic. So, in my perspective, the people have to be take care of the sanitization. Even though we know in our country before COVID, also in rural India, in rural areas, some people are still are open defecating, and some women are not using the sanitary napkins. Still, they are using cloths. And the main problem of the disposal of sanitary napkins like that means, uh, as it was contents of plastic, it was the main problem also. They are simply they throw out the sanitary napkins in open places like that. So we have to take so much care and so much tips to take care of sanitization and hygiene in our India. Yeah, that's it.
Thank you, Amrita. Mr.
Thank you.
Vasanta Rao, please. Uh, you are on mute. I think your speaker is not connected properly. We are unable to hear you. Uh, while you check that, can I move on to Mr. Saran Subramaniam, please? Okay, Mr. Saran Subramaniam is expected in about 5-10 minutes. So I will move on to Mr. Ashutosh, please.
Yeah, hi.
Hi.
See, in terms of with regards to our response to uh, additional sanitization requirements that happened because of COVID, and that the appreciation of that. Um, apart from the things that we did in our own office, we did something different during this time, at the time of lockdown. In one of the communication from the Pune Municipal Corporation. We are based in Pune, so we understood that in certain areas which are already into quarantine, which are into red zone, but more to do with the low income group, where people are there are community toilets and people are packed together because of the density of the people is very high. So, and it has to do with the low income group at that time. What the municipal corporation understood was that if a COVID positive patient used a toilet, a community toilet, a common toilet, and he used it for, let's say, 10, 12, 15 minutes, whatever. After that, even if a COVID negative patient, a negative person would enter into the toilet to use it, then there were like 90 to 100% chance that this negative guy would also become positive, because this positive guy had earlier used it under a closed environment. So we understood about that. Now what we did is that we manufacture products which has not to do with the killing of the virus, but what our products do is that they eat we make bacterial products, and these bacterial products eat away all the solid muck, the human waste which is present inside the toilet, and which gives bad odor, which gives a bad smell, as well as the cleanliness of the toilet, overall cleanliness of the toilet. Now, what happened was that we approached the Pune Municipal Corporation saying that we are a Pune-based company and we would want to contribute. So they gave us a location which was a red zone, and where there were many distinct patients also identified. and we took up those toilets for the cleaning through our own products. So we have our own products which are bacteria based, and they clean the toilet in terms of the liquid, in terms of eating away of all the waste, and in terms of the cleaning also. Now, I'm sharing this with you because I somewhere agree with Dr. Burkel, where he said that it is there is a cost effectiveness in this, in the use of the right products for the right application. There is a cost effectiveness. It is not about that you are losing cost on account of that. What the Pune Municipal Corporation came back to us was that during the COVID, they were cleaning the toilets, these community toilets, they were cleaning it 4 times in a day, because that was the requirement. The cleaning was such kind of a thing. And after they started using it, 1 month from that, now the cleaning of the toilets has gone down to two cycles in a day. Now imagine what is the cost of manpower that is saved, the cost of chemicals that was getting saved, because we replaced it from chemical disinfectants to bacterial disinfectants. So somewhere I realized that it is not about our from our side. Our initiative was to contribute in whichever small way that we can. However, what it turned out was that it was a very beneficial thing from a community toilet point of view. I would not say from our residential owned toilets, but from community sanitation and hygiene. So that really helped. So this was my I mean, and as Mr. Virenderji also said, that this COVID in a way is coming out as a very positive thing in terms of the shaping of our minds, that suddenly there is a lot of importance coming into the right things. So on the
Yes.
same lines, we also realize the same thing, that you do a small thing, a small gesture, and suddenly there is so much amount of betterment that happens, which even you did
Yes.
not imagine. We did not imagine that we are going to save the cost in such a big way. So, and
Yes.
of course the soft benefits that we got was different. We got covered in the national newspaper, and we got interviewed by a radio jockey and stuff like that. We had not imagined that. So whichever way you look at it, I still agree with Dr. Burkel when he says that cost is not the issue. It is, if the
Absolutely.
priorities are right, then it pays for itself. So, thank you.
Absolutely, absolutely agreed. That was very innovative, and that was a very, very, empathetic, actually, initiative. Because when we start thinking about, the health, community living, and community hygiene, I think only then we can start thinking about all these initiatives. I'm waiting to hear more actually from our other panelists as well. Adesh, I would like to come to you. Please share your initiatives, what you have been doing.
Yeah. Hello, everyone. First of all, just I want to introduce, just as a new entrepreneur, we have just launched with a GoCo travel buddy. As due to an pandemic, we have found that like a lot of people are facing problem. As we consider a nuclear family in which ladies are the homemaker, lot of trouble used to be there if a person getting quarantine or getting hospitalized. So somewhere somewhat a hygiene can't be maintained properly. In with due respect, we have just find out with a new product, come up with a new product. We have a GoCo travel buddy, because just keeping a mask on a face or sanitizing our hands is not a proper cure. So we have come with a travel buddy kit in which we are providing a disposable. Everything will be a disposable bed sheet, pillow cover, a mask, latex gloves, like these kind of a combo we have created, because people can't afford anything. Like people can afford just with a mask and sanitization, but somewhere they will forget the things to carry. So we have come up with that combo product, and which is quite helpful, and which is helping people for getting home quarantine and sanitization. So taking that perception, like hygiene can't only with maintain with face mask and hand sanitization, proper care to be taken. And due to pandemic, lot of people and economy has gone down. So in that duration, people are not coming out. But concluding to the economy, now people are coming out and moving for their marketing and their businesses. So with that respect, we have come up with a GoCo Travel Buddy Kit, a complete combo, which is easy to carry and
Thank you,
dispose.
Adesh. Amit, your comments?
Yeah, hi everybody. A very good afternoon from DSR Robotics. This is Amit Agrawal. Thank you, Sushma ji, and it's a lovely panel out here. I think everybody has almost covered everything, but I do have a couple of points. I totally agree with Dr. Burkell on the point that it's an investment in people. But I would also go ahead and say that it's an investment in the most important resource, which is our Mother Earth. I mean, there's nothing that we can replace. We can replace almost everything. Even people, more people will come. I'm sorry if they die, but we can't replace Mother Earth. We can't replace our land. So the biggest problem that we are facing right now is with the subsurface infrastructure. Sanitation, two parts, solid and liquid. The solid part is being taken care of because it's above the earth. Everybody can see there's a lot of work going on. And if there is something wrong, then people point out. The problem is with the subsurface. It is actually contaminating the earth from inside, contaminating the water resources, the aquifers, and hence creating it's actually increasing our cost of water, cost of living every way. And I think, as Dr. Bakil said, that it is an investment, and we are always thinking of it as an expense issue. And that is the mentality which the most of the municipal and other agencies in the Indian government, they have, that it is an expense issue compared to water, the sewers, the drainage. But they are not. They were actually an investment, and we have not done it, and we are facing the problem now. So what can we do? I would say my take onto it is enforcement of SOPs and enforcement of the new technologies that are there to evaluate and rectify. We being a robotics company and into inspections most of the cleaning technologies that we create are using robots only. I would I would be saying this that to your first question, to your initial question regarding what we are implementing at our own premises, we are handling biohazard scenarios for a very long time. So again, as Mr. Call said, it's nothing new to us. We have been implementing procedures like that. In fact, we cannot allow equipment to come inside our office unless until it has been sanitized. So that's a very old thing for us. But then, what have we done for this for the current pandemic? I think our contribution is that we have been working on our robots, and we have been trying to educate more people, more departments about the availability of the solutions. And now with the COVID pandemic, I think people are they are not only aware, but they want to know, and it's very easy to reach out. There's a whole mindset change, and I hope that we are able to react to this particular scenario in a much better way, and we continue our efforts. Thank you so much.
Thanks, Amit. Thank you, Amit. I want to move to Dr. Burkell again. And I would like to ask Dr. Burkell that where does India stand compared to other nations as far as the infrastructure? Amit rightly touched upon the infrastructure. Where does India stand as far as the infrastructure is concerned? To meet the sanitation and hygiene levels, number one. And number two, the kind of waste that we are creating in the current times, with everything that we are making is disposable, and it needs to be thrown away, and it needs to be biodegradable. So waste management also has to be a part of this entire sector. And how do we create infrastructure that will go hand in hand? So would you be so kind to share your inputs on this, please?
Okay, thank you. And you leave the difficult questions for me. That's much appreciated. Let me try, but let me also maybe respond a little bit to earlier comments, because I think we have a tendency to speak about post COVID. And I think this is also putting us a little bit on the wrong footing, because we are not at the situation as we post-COVID. We will have to deal with COVID for the next few years, at least, until there is a real solution for that. So that is a bit of an issue, that we should not create a false sense of security. And that's also with all the personal protective equipment, there's quite a lot of evidence that basically the masks and the face masks are not really protecting you, but it gives also a false sense of security, that you're safe if you have a mask, but you should really wear it around your nose and your mouth. But even then it's really limited what it does actually in terms of protection. So really hygiene is there. Then I come to your question on the infrastructure, and I think that the earlier conversation was that yes, the underground infrastructure is difficult to view. So what do we do with the sewers and the drains where the wastewater is actually going? And there, India has to make a really big move forward to treat the wastewater and avoid this. And this has been highlighted in the Clean Ganga program and other missions and so on. I don't have exactly the international comparative numbers, but there is a major investment needed, and this will have to come from basically integrated in the city planning and the urban planning, where we have basically two agendas. One is to make sure that if we do new developments, that we again don't cut cost and try to avoid on doing the proper infrastructure for sewerage and waste management, but we need to bring it in right from day one. It's the cheapest if we do it on the first time right. So that is really where we need to find a way to also to have the responsibilities cleared up. So there's the planning responsibilities in the states, and then there's the urban municipal corporations which have the investment responsibility. So we need to bring there better collaboration on the planning of new cities. I think for the older areas and the congested areas, we need something like what India has done on the metros. So basically give high authority. We couldn't get the metro system until there was a higher authority given, that we really need to quote unquote almost bulldozers through to create the infrastructure, because the old areas of Delhi and the other cities, they have not been designed for the sanitation requirements that we need right now. And at some point in time, we have to bite the bullet and make the investments to clean up and to provide the modern infrastructure that is needed for that. I think you also mentioned the waste management. So allow me to just come in then on of course the hot topic, which is the COVID related waste. So that is the biomedical waste and all the PPEs which come in. And this has been an area where UNIDO was actually working on biomedical waste management in India before this COVID started. But if you go by current figures, there's about 8 kilos of COVID infected waste for every infection in India. So if we put that in perspective, that is about 50,000 tons of COVID waste already in India. But the data are very scarce, but it gives you an impression of the size of the problem. I was talking to the West Bengal Pollution Control Board earlier this week. They say 17 tons of COVID waste every day in Kolkata. So what are we going to do with that? And there's a lot of infections associated with that. So in principle, we have there the right regulations. So we have the Biomedical Waste Management Act and the management rules from 2016, 2018, but we still see that there is a reluctance to try to apply. With the work that UNIDO did in 5 states, we worked with 160 hospitals, and to introduce an efficient and effective waste management in hospitals to address the infection control, but also the environmental component. So if you manage waste in an efficient and effective way, you protect people from the infections, and you also manage the environmental impacts. So we now see that with the education that comes into the hospitals, and then segregated collection and proper management, that these hospitals which have done it well, they are saying we have near zero infections. And near zero means that probably there's nobody infected in the hospital, but somebody might get infected in the communities. We understand this is a very sensitive issue. So normally the hospitals want to come out and say how many infections have we in the hospitals, but without any doubts, there's hundreds, if not thousands what's happening in hospitals. And I think this is really one easy area where if we want to stem the spread of COVID in India, we need to focus on this waste management in hospitals and make sure that not the PPEs which we generate also in commercial areas and everywhere in the community, that this is managed properly to avoid the infections there. So I'll leave it there. Back to you, Susma.
Thank you. Thank you very much for those inputs. Again, I would like to, because we have, many panelists and many views, I would like to, again pose a common question to cover all the views from all the speakers. I want to break down this question into 3 points. One is in your current business, what is the kind of challenges you face, or what is the kind of challenge you are facing as far as the sanitization and hygiene products or initiatives that you are taking, you are facing the challenges. Number 2, what kind of other opportunities which are existing? Like, I see waste management as a huge opportunity for starting up new businesses, and I'm sure many of our viewers would be interested in and exploring opportunities in waste management. So in your current line of business, what are the opportunities you see? And lastly, what kind of support you are seeking from government or maybe organizations like us, which we could lead or maybe take forth in creating a better ecosystem for the years to come. So I would like to start with Virender ji, please. So just for the benefit of everyone, challenges or business opportunities in your line of business, and government support that you are seeking. These are the 3 points, if you could quickly break down. And yes, sir, Mr. Call.
So the main thing that present the business which are having, we have diversified our manufacturing towards now surface disinfectants, which are much in demand nowadays. We have started manufacturing mildly 2, mildly 5, mildly 10. This is benzalkonium chloride, a surface disinfectant, a very old and established surface disinfectant, and was being used earlier to dress wounds even in very minute concentrations. We have already diverted toward this. We are marketing our mild range. We have diversified our production. We started production of hand sanitizers. They're much in need. Basically, the problem nowadays is the economy of the whole country has gone very down. People are not able to come out. People are not able to utilize the services which every sector is providing. So there is no money circulation. And in our pharmaceutical industry, patients are not able to go to doctors, and doctors are not visiting their clinics even, because they are also afraid they might be getting a infection. So the need of the hour is to sanitize everywhere, every place, every surface. Maybe a hospital, maybe home, maybe factories, maybe offices. And the first thing and the only thing which I always feel is the most important is the awareness. Unless and until our masses are aware, it will be difficult for. We have to, and governments, see, I tell you one thing, government has to help entrepreneurs. The problem is that every corner of India, and in every corner there are a lot of good brains. They are creating something or other, and government has to encourage them. Implement similar solutions in whole of country at various places, at small places, at village level places. Creating a big thing is not going to help. We have to use that similar thing. Similarity is better. Suppose I tell you a small example. In Bihar, we have got a lot of fluoride in water, groundwater. We have to see something, how we can reduce it, how we can reduce and make that water people can take it, and implement those problems everywhere in India, wherever we have a similar problem. Similarly in sanitation, whenever we feel that some people are not adhering to the hygiene. They have to. Something has to be devised with which they can obey, they can follow, and then it will become a habit. Suppose there is a before this Pradhan Mantri ji, he is very solid effects, really solid efforts he did about this open defecation. If it is done, when one family goes to a toilet, other will also follow. Our Pradhan Mantri has made toilets over everywhere, but somewhere they are being used as storerooms. They are not being implemented. Give proper use of the proper things. We say we don't have money for this thing. We have enough of money, but money is not being utilized proper. You see a lot of drainage, sewage lines. They are all blocked. They are not working. It rains, water gets accumulated. Everywhere you are finding only bacteria and germs. So we need to do something for this. Government should encourage entrepreneurs at small levels, village levels, town levels, and then that has to be followed everywhere. Then only things can happen. Otherwise, the only thing at present, which our doctor colleagues are saying, this a mask is as good as a vaccine. The vaccine nowadays, but I'm not seeing that this will be very big success because the immunization it is providing is very short. So we cannot depend on vaccines. We have to depend only on sanitization, distancing, and wearing mask at every place when the moment we step out of our houses. So
So you are saying
manufacturer,
prevention is better than cure. Huh?
yes. Cure I don't foresee in very short distance, maybe for 1 year, 2 years even. Medicines, every day one or other medicine is effective, and after 3 days it is not effective. And then vaccines, which has been very much proved that no vaccine is giving immunity. You see, vaccines, the base is basically your body develops antibodies against that particular infection. And we have seen patients coming just after 2 months of their first infection. What does that mean? That vaccine will not be successful. It will take a lot
Okay.
of time to develop some vaccine. So we have to prevent by sanitization. Our
Okay,
every
so I
surface
move on
should
to
be
Mr. Rao. Thank you, Mr. Kaul. I move on to Mr. Rao. I hope the issue with your speaker has been resolved.
Yeah, I am audible now.
Yes, you are very
Yeah.
much.
Thank you very much. We are actually in food business, basically food additives and processing aids. It is linked to the sanitization. We are before COVID, we are supplying this product for UBL and all companies to wash their barleys and vegetables, some neo foods and like food industries. They are packing to other countries fresh vegetables and non-vegetarian, so many goods. So after COVID, a lot of Indian women, they are suffering how to bring the vegetable to home and washing, where they are virtually they don't know this virus has come from, where it actually appears in some places or from vegetable. They don't have any this one, but surprisingly on gone this issue, I said federal health official estimated the nearly 48 million people are sickened by food contaminated with harmful germs each year. It's something is the causes might surprising you and all. Although people know the animal how to handle carefully, but they cannot know about the culprit on outbreaks of food illness. In recent year, United States had several large outbreak of illness caused by the contaminated fruits and vegetables, including Spanish, caterpillar, tomato, potato, etc. So we thought of introducing this industrial what are using in the food production as a sanitization in our daily basis, which is more important for our daily users. You probably knew how important it is to sanitize fruit, vegetable, and after spread of COVID-19. But before that also it was there. But after coronavirus, everybody was aware of this. So for this, we people are in WhatsApp, in everywhere. They are just says some lot of information spreading, rumors. We can say you just enough to wash in water or use some baking soda and all. But US Department of Agriculture is saying these all are bad idea. Actually, for what saking I am saying is, environment group released dirty dozens of highest pesticides using on product like apples, spinach, tomato, potato, hot peppers and all. And the virus came from non-veg also. It's started from everyone aware of. To solve all these things in a single spot, we decided to make one best product. We Vajra Farm Food, we produce one best product to clear even porous material like your porous vegetable, what do you say, agaricus, mushroom that using, and like carrot, all these things to be washed before this one. By considering all this above point, we have bring with a unique product and very simple way, and every woman can wash very easily with this and sanitize this one, all vegetable and fruits. This is.
We got you, Mr. Rao. What kind of government support you are seeking? Are you seeking any kind of government support
Yeah,
for
because
what kind of business or any challenges you are facing?
yeah, because this is approved in USA and long back, and Canada Food Inspection Agencies and Food Standard Australia and European Food Standard. Luckily, Food Safety Standard of Authority of India is also recognized this and supporting this the licensing and other part of the this one
So you
moving
have
in the
got
market
the
and
so you have got the license, right?
yeah, we got the license, and we are so people like so many people are coming with neem and all. They have some licensing authority. They check whether if you are saying as dirt is going, waxes are going, or say day-to-day life you are seeing so many viruses are removing. So justification for that, some control should be there, and along this control, they have to say this is very important factor. The germs, bacteria will come all together to home because of vegetable and non-veg. The simple product you will wash both veg and non-veg. So government has to focus on this, because I said now 48 million people are suffering from the health illness from the vegetable and non-veg.
Okay, taken your point taken. Mr. Ashutosh Vedangekar, your comments, please.
Yeah, your question was very specific. Three things. One is
Yes.
the challenge. Second is the business opportunity. What does it have? And third is the government support.
Yes.
Yeah, in our sector. Now the thing is that if you talk about challenges, see, this is now in terms of the challenge, it is a global situation. The business environment, the business sentiment has taken a toll. So in the private and the government sector, in the more so in the private segment, new investments are not coming in, because of which it presents again an opportunity, in a way, to say that if new projects don't really come up with that same speed till that time the economy really reboots itself and stuff like that. So in this kind of a situation, it does present an opportunity that if capex is not coming, if capital expenditure is not coming in from the industry, definitely the industry is more moving towards spending a little higher on they are ready to increase their operating expense, but take in better goods and services. So while this situation, where this economic turmoil is a challenge, it also presents an opportunity that we can have as a business. I can have my business structured in such a way that it also provides goods and services, more to do with the services industry, where the industry is ready to spend more. This is one part. Second is, I'll go to the third, which is to do with the government support. Now, in terms of government support, my take would be that, logically speaking, whatever needs to be done, quite a few things are being done. But the greatest power that the government has, you go back ages also, is to pump in. You want to revive the economy, you pump in more. You pump in more money into the economy, and it rotates. It leads to a lot of business. But there is one more thing. There is a second thing which the government can also do. This is something which is known. People know, the government also knows. But the second thing which I am trying to say is that government at its disposal has excellent communication channels to disseminate, to give out information to public at large, to people at large. So there are many things which happen in terms of awareness building, which in turn leads to business, to entrepreneurs who are solving specific problems. I'm not saying just selling of products. I'm saying solving a problem, and hence your product gets sold. Product getting sold is incidental. You are basically essentially solving a problem. So what I mean to say is that government can use its huge amount of platforms, and one of the platform that they would do is like organization like yours, and FIO and Chamber of Commerces and stuff like that, and MSME Mart and GEM. These are all government bodies which can give a huge amount of information. This is from the government side that I would say. Second thing that I would expect from a government would be that to have a time-bound execution of things, because a time-bound execution does help a lot. Touching upon the business opportunities, I did have the liberty of time because there were two more speakers before me, so I could jot down a few things very quickly. So see the thing is that 48% of rural India was defecating in the open. This is from the Government of India website. Now today 99 to 100% of the villages are defecation free, so to say. If there is again a review of that, maybe something has gone back, as Mr. Virender also said, some people are using it as a storage medium and stuff like that. These inefficiencies are going to come up and stuff like that. However, having said that, there is a huge market for simply building toilets. I mean, we are talking sanitation and hygiene. So the first thing that it's to the toilet. And when you build a toilet in a school, the girl child gets educated, the entire family gets educated. Again, quoting UNICEF report, it says that if you invest $1, because it was given in dollars, hence I'm quoting the same, you invest $1 in an urban economy for the sanitation purpose, it will give you returns of $2.50 in terms of the money saved. If you invest $1 in rural, it will give you $5 saved, 5 times return, and this is pure economic, I'm saying. But and the moment it satisfies economic rules, that means there is a lot of business. So building of toilets is one. Building of community toilets. As an entrepreneur, I can build up a community toilet, take it up on boot mechanism. I would run the toilet and I would charge. Of course, the charging mechanism in an urban setting would be different. In a rural, I would be more subsidizing it. The CSR would come from good organizations who want to do it. They just want a dependable partner who would want to do it. Then for the one part is the building of the toilets, which Honorable Prime Minister said it from the Red Fort, and after that invested lot of amount of money and efforts from the government. Now, building of the toilet is one part. Second is, what do you do with the wastewater generated from the toilet? That needs to be treated essentially, or it will go down into the in the aquifers, as Mr. Agarwal said. So what we had already come up with something like a product like this. This comes in a water soluble package. It's a starch paper, and inside there are bacteria, and you need to throw it. You need to toss it into the toilet itself. When you do that, the packet melts off. It dissolves into the water, and these billions of bacteria are released. Now that goes into the toilet shit pot in the collection, this thing, and it eats away all the solids. When you do this, the aquifers don't get polluted. When you do this, the treated water, even in the rural setting, or assume a Jilla Parishad school, which has a toilet and the students are using it. And
So the septic
essentially,
tank of the, yeah.
correct, the septic tank
Yes.
cleaning won't be required and stuff like
Yes.
that.
Okay.
This I was saying more from the this thing from a from this for the small toilets and septic tanks. However, from the when I say about socially and economically relevant projects, boot-based projects where a public-private partnership can come in. For example, RCF, Rashtriya Chemical Fertilizer in Mumbai, it takes a flowing nala. It takes that water, it takes the sewage from there, treats it, and uses that treated sewage to run their fertilizer complex. So again, this kind of a projects at a smaller basis also makes a huge lot of sense. So again, from a government support, if I come back and relate it with my own product, because we make bacterial cleaning agents also, and bacterial these kinds of products. I look at it at a situation where government would be made aware of such kind of products do exist through organization like yours, and then they would make it mandatory to have such kind of technology given for free to the rural India.
Okay.
So this is how I look at it.
Amrita, thank you. Amrita.
And then they how I look.
Yes, ma'am. Yeah, ma'am. Ma'am, coming to that point that you are giving the challenges nowadays, yeah, it's a very big challenge to my startup company. Only 12% of the women are using the sanitary napkins, and remaining 88% of the women are using this cloth, etc., like that. So nowadays, what the women is actually doing is they are using the old clothes which we are going to donate from others, like that. But after COVID, the people who are using the cloths and rag pieces like that, they are actually really fear of that. Okay, these are whether these are hygienic or not. So it was a very big challenge to me that I have to manufacture more number of the sanitary napkins so that I can provide the sanitary napkin with hygiene and more affordable to the women who cannot afford the sanitary pads for their menstruation period. Coming to the business opportunities, see, ma'am, nowadays I'm in Hyderabad, okay, and my district is from Srikakulam district, okay. I can't manufacture and supply the sanitary pads from here to there. It was of somewhat it was increasing the product cost also. So what I am giving that is whether we are giving the a business opportunity for the young women entrepreneurs, so that for every place, for every district, every woman are coming in front to make the manufacturing units of making biodegradable sanitary napkins. It will be more helpful. It will be more helpful, and it will be very affordable, and it will be very वहाँ के लोग को अच्छे से मिलते हैं. कहीं कहीं हमारे रूरल एरियाज है, थोड़ा ट्राइबल एरियाज है, वहाँ जो लोग को नहीं मिलता है अभी. अभी देखो मैम, हम एक स्नेहा हस्तम वात्सल्यम और थोड़ा एनजीओस में मैं कनेक्ट हुआ था, कदम या वात्सल्यम एंड स्नेहा हस्तम फाउंडेशन से हम एनजीओस को चैरिटी करते हैं. तो वो लोग क्या है ना कि ट्राइबल एरियाज को एंड वुमेन दोज हु आर नॉट अफोर्ड दीज sanitary napkins, we are donating the sanitary pads through them, and we are giving the sanitary pads to the very low cost price. So the challenge is now the business opportunity is if you are starting any manufacturing units in that places, mainly in rural areas and in tribal areas like that, so that the women in that place can use the sanitary pads, and it was very hygienic to them. Okay, why? Because I think that most of the women are now decided that okay, we are not going to supposed to use the rag cloths and the cloths during menstruation. Why? Because before COVID also we can use anything, any piece of cloth for menstruation for the menstrual period. But nowadays, recently my maid was going to ask me, ma'am, I'm not ready to use the cloths. I want to the sanitary pad. So see, how she was, I mean उसको पता
तो
चला है
फिर
कि
पता चला तो
अच्छा
she has now
sanitary
adopted
napkin
that.
अभी यूज करना हमको.
Okay. So
Yeah, she is no. So and one more thing, ma'am, and yeah, and so many of the mats. I was communicate with so many children. Also, the children also told me that, ma'am, before we can afford our sanitary pads, like 30 rupees whisper pad, which was marketing in available, but now we can't afford, ma'am. If you are going to supply, so last month we are going to supply so many, and we're collecting the funds also, and we're giving the so many sanitary pads, especially for women. And one more thing is, I want to need a support, but that is in my experience, in my journey. Once I went to one Karimnagar district near Telangana to a government school. There, I used to supposed to tell that people you have to change your sanitary pads for every 6 to 8 hours. So then one of the girl told me that, ma'am, we have no water. How can we change our pad? See, in some areas there is a water
yes,
scarcity also is there. So my request to the government is, please provide somewhat water facilities. I suggest the rainwater harvesting facilities, so that if water is there, then only the children can do the hygienic methods and wash their hands, whatever we have to take care of that in this pandemic situation. After, I mean, see, nowadays the schools was not there. Okay, the children are in home itself, but after once opening the school, we don't know what the virus and what the spreading. So my suggestion is, when if you are going to provide the water to the government schools, I mean, giving all facilities to that, so that they can
I think we've lost Amruta there.
most
Yeah.
yeah, and one of the most challenging part of my product is disposable. See, the children who are in NGO homes and orphans, and somewhat in I mean, living in tents like that. So the most challenging part is that how to dispose that sanitary product. So this is a very, I mean, this is a very big task to us. So first of all, we are going to introduce some what paper, I mean, paper wrap to dispose like that. But due to that paper wrap, it was again I mean, again the pad was going to expose it to the environment, so it was not look good. So actually, my intention is, I want to introduce oxy biodegradable, which was biodegradable in 18 months to 2 years. But see, the people have don't have that idea what is oxy biodegradable, what is the difference between plastic and polymer. Some are going to tell that, okay, it was I mean, if it was plastic means it was more comfort that. But before using the plastic pads, we are not. We of course we are using very comfort. We are feeling very comfortable by using plastic pads, but it was not at all good to our health in one day, and it was not good to the I mean, environment also. We do not. I mean, we are not getting the problems in day one, but we are getting the problems at the end of the day. See, now
Okay.
this yeah, that's ma'am. So
Yeah.
that is I need government support for that toxic biodegradable and whatever for my product. Yeah, thank you.
Okay. So, okay, so we understand. I mean, each product, each service, each,
Yes,
the entrepreneur that I'm talking about, we take one product or we take one service, but the
yes,
cycle does not complete till, it reaches the entire chain of
yes.
raw material to the product to the final
Dispose.
waste
Yes,
management as well after disposal, and
yes, ma'am.
again mixing it with air, earth, water and soil, and giving it back in the natural form. So
Yes,
yes, that's very very important. And in fact, this, until and unless this entire cycle is achieved, I
yes,
don't think we'll be able to achieve sanitation and hygiene in its true form or true spirit. However, we are
yes,
yet to listen from Amit and Adesh and Tapsi. So we are also short on time. So I'll request them to make it please quick and precise. Amit?
Yeah, thank you, ma'am, for this. I think it's a valid question. in theme with the organization of this event, I can recite one thing. It's Apah Punantu Prithvim and Prithvi Uta Punatumam. This shlok from the Vedas says that the copious flow of rainwater purifies the earth and removes the dust, dirt, filth, and garbage from the earth. And this purified, the earth provides me with clean and hygienic food. So you very rightly said that the whole cycle has to go through. Okay. In our arrogance, we have, since we are specializing into subsurface utilities, I can talk to you from that point of view. The challenges that are there right now are largely, we initially in India, we had this kind of a thing that we are a country where there is too much water. Okay, actually, there was too much water. We are the only country in the world which gets these monsoon kind of a climate. So we have poor crops and huge amount of rainwater. Okay, almost 5 times what we require. But we mismanaged it to a level that we don't even have half the water we require from the rain. It's all of that water is water all around, not a drop to drink. That kind of a situation. So now, what to do? The opportunity is that new technology has to find its place to solve these problems. It has to be enforced. That is the government's responsibility. We make the government enforce this. That is a responsibility of an organization like ISF. And for people like us, the entrepreneurs, we can only make that technology. Okay, so for example, during COVID, we came up with a couple of solutions. One is the NCD robots, which is the no contact delivery robots. I think Dr. Burkill was again talking about a lot of problem with the hospital infrastructure. That is where, since we are specializing into biohazard scenarios, we designed a robot that is able to handle that kind of a scenario. Because most of the robots that you see right now in the industry, during COVID, that you have seen on TV and all, they are primarily hospitality robots. Okay, they are made to serve people and not in a biohazard condition. So that is where we came in with a new concept. Now, similarly, there is a problem. There was already a problem of manual intervention in cleaning of subsurface utilities. So we had our designs for a very long time, but over the last 2 years, there's a lot of interest, and especially now because of COVID, when we know that COVID bacteria and the virus can easily survive in sewers, and for a much longer time than in normal environment. The municipalities and other agencies have become very, very cautious. They are extremely interested in reducing manual intervention, and that is where our sewer desilting robots come into place. What else we require in terms of support from the government? I think one of the biggest problems any technology provider in India faces is our tendering law. Okay, we do not have an option for a single tender. There is an option for single tender according to the Vigilance Commissioners, the Central Vigilance Commission, but no officer, because of the stringent rules, no officer wants to take the risk of giving out a single tender. So when you have something which is either a monopoly technology or an innovative new technology, patented one, or a single source technology, how does somebody get a second person to vouch for that tender? Okay, we have faced that many times. Several tenders have gone down the drain over the last 10 years, where because of a single tender only, even global participants did not participate. Nobody wants to give a second tender. There's nobody to give a second tender. Similarly, second problem we are facing right now, because the second challenge is I would say the payment cycles, especially in the municipal. I'll make it quick. I'm sorry, there's a shortage of time. In the second, there's a problem of payment cycles. The departments don't have money, so when they're not paying the EPC contractors, we are not getting payments. That is a problem. Third problem, I would request the ISF to intervene is, we have to somehow force the government for enforcement of SOPs. Like, for example, there was a thing, driving licenses, everything was there in terms of the infrastructure. You even had for driving license plates also. But unless until the enforcement started, okay, because of cameras and other technology, it never was a success. Okay. And last of all, there is a big problem which has come. People in India are taking advantage of the COVID situation in a way that right now, service provider, the service cost is going down. It is not going up. Okay. For a manufacturer, we are supposed to sell low, at a lower price. But the raw material prices have gone, they've got shot through the ceiling. Okay.
Yes.
Because all we hear is, oh, imports from China has closed. So that is why this has gone up. Okay. If you find out with the customs department, imports are still going on. Okay, so it is simply people are taking advantage of the situation. Government has to intervene. This is very much required. The raw material costs have shot up by 50 to 100%. Thank you so much. That's all.
Thanks, Amit. So we have Tapsi, and then thereafter Adesh can go. So Tapsi, over to you.
Yeah, thank you, Susma. Actually, I think the biggest challenges when it's come to the sanitizations and hygiene issue in India, that is the lack of awareness and the appropriate facilities. Most of the drainage and sewer systems are outdated and not equipped process, and large amount of the human wastage product by cities and their inhumanable informal settlement. There is also lack of etiquettes like the waste treatment plant, which is result in massive quantities of waste and being of damp into the rivers. The highest percentage of rural populations living without toilets till now. So water clean efficiency, personal and domestic hygiene practices cannot be improved without improving their basic elements and such a water supply, waste management, disposal, and solid waste management. That will be the problem of the current scenario. In terms the government's what type of help we needed, like from I am completely agreed with Mr. Ashutosh. Definitely investment need in these situations, because after the post COVID situations, the small industries, small SME companies and MSME companies are not a breathing space as of now. So in terms of that, we needed this. Regarding the new opportunities, like your third point is that what type of new opportunities are there. In the early days of the COVID-19 pandemic, the consumer, taught the market like the hard sanitizer and other sanitized product. The personal hygiene market expected reach, US dollar 15 billion by 2023 in India. So personal hygiene products will be the continue to see the higher demand, as the consumer won't want to compromise here. The consumer buying behavior also shifted tremendously after the COVID-19 impact. And now here the most of the apparent like the personal hygiene, sanitary product space, most of the individuals are now carrying multiple bottle of sanitizer and masks. The many consumers become a more conscious regarding the health and taking the preventive step against the disease and cause. We are also in housekeeping and sanitizer sector. We got lots of call that we please sanitize our offices or sanitize our home. So these all are the opportunities, current days. As per the report, in the sanitizer segment witnessed the man mouth growth is 53% in February against 11 percentage growth from November to January. The sudden increases demand, sometimes it's make out of stock in sanitizer, the masks, gloves, and these type of issues are there, 2 month or 3 month back. So these all are the situations we have to take care, and we need a help from government, and that definitely investment purpose we government have to help us. Thank you.
Okay. So finally, Adesh. I think Adesh is having some network issues. Um, Okay, so before I close on today's panel, I want to move to Dr. Burkel for some closing remarks after having heard all our entrepreneurs. Of course, there are challenges and they are doing their bit, and there is a long way to go actually. So I would like to hear from Dr. Burkel his perspective on the current scenario of sanitation and hygiene, because I feel we are all working in silos, and there is a need of a concerted effort of completing this entire cycle and meeting this entire cause and benefit and the entire initiative of giving it back to the nature and earth. So closing comments, Dr. Burkel.
Thank you very much, Sushma. I think the very interesting comments were made by the different panelists, and each angle you take, there is valuable insights. And I think it's as a cross-cutting issue, there clearly are discrepancies in the system and the policy measures. We need to look at contracting procedures, procurement, public procurement, and so on. I think that what is really important is that what some have referred to as standard operating procedures, or the SOPs, which are there, which is basically the environmental rules and regulations and the waste management rules and the sanitation rules. They need to be respected and implemented, and there needs to be an enforcement for that. And that's one can argue a long way around, but this is also basically the right of the citizens. People of India have right to a healthy environment, and that's even enshrined in the Human Rights Convention. But I don't want to go that way. I think that everything should be done to try to keep people safe from the environmental impacts and the health impact of waste and sanitation, and that needs to be done there. I think one point I did not hear so much in terms of what government can do. So we talk a lot about that. Of course, the economy is down, and we need a stimulus and a recovery package. The economy is down, and we need a stimulus and a recovery package. I think that some echo is coming through, but I wanted to say from the recovery package, we can say, oh, any money is good or to any purpose, but let's also take this time that government is going to invest largely into a green recovery, where there is where we invest then in sanitation and waste management. So this is the time the government is going to spend. Let's not spend it on everything, but let's spend it on things which is India is going to benefit from in the longer run. So this would be a unique opportunity to address some of the wastewater treatment, the waste management issues, and do all the issues which bring us better in terms of sanitation and hygiene, and set us better up for dealing with pandemics that we are in right now.
Thank you, Dr. Burkel, for those insights. I mean, after hearing all the panelists and the discussion today, it has been very, very interesting. And my couple of key observations I find from the discussion today is that, we see developed nations spending such huge budgets on health, sanitation, water, other safety measures, toilets, and all of that. But as far as India is concerned, we are yet to achieve that mark. We are always used to this firefighting mode, we call, like, okay, now today we have COVID, so we start with sanitization, we start washing hands. Tomorrow we have chikungunya, so we stop eating chicken, or swine flu, we stop eating eating non-vegetarian. So I guess we all need to rise above this, take our lessons from COVID and make some drastic changes to our lifestyle, to the way we look at sanitation, health, immunity, and hygiene overall. We spend so much money. Tapsi said, yes, there has been a rise in health and beauty products and all of that. We spend on beauty products and all, but what about hygiene? What about immunity boosting foods? What about natural foods? What about keeping the surrounding clean? So we only believe in keeping our homes clean, but we are not bothered about what's around us, the filth, the garbage, the slums. So we never take up these issues and look at the larger effect that it is going to have on the environment, atmosphere, and eventually future generations. I feel there is a huge need and a long way to go as far as the budgets is concerned. Budgets both on personal level, entrepreneurial or enterprise level, and government level. There is huge effort to be taken, concerted effort to be taken for creating awareness, creating standard operating procedures, more innovations on these sector. Lot of technology transfer is required from developed nations to come to India. And of course, change happens with us. And I guess we have to pledge to bring, or be that change that we want to see. So I guess a lot of things to be done, long way to go. And in fact, I would like to request these ambassadors who are working in health and immunity sector to not just work on just their sector, but also be ambassadors of sanitation, hygiene, cleanliness, and safety to the entire nation and work on a concerted manner. That's the need of the hour. With that, ladies and gentlemen, thank you so much for joining us today. Thanks to all our viewers who have stuck around and who are here with us. A special thank you to Dr. Van Berkel to have joined us and given us perspective, both international as well as India, and talked to us about the scope where we need to work on. With that, thank you very much once again, and have a good evening. Bye-bye.
Thank you, Kusma. Thanks a lot. Namaste.
Thank you. Thank you and Jai Hind.
Thank you so much.
Thank you,
Jai
Vardhan.
Hind.
Yeah, thank you.
We
Yeah.
you all